No, these are computer. But the good news is you're back here.
I'm kind of looking for I know. I was so excited. Like, not that I have just got to explain what happened.
Just having this technical difficulty that we'll do in a second.
I was just telling you, it felt sort of bad. There's such a bunch of books. There's books and books. She's got a lot of right little. Like she's got a lot of. It's really
Okay, they told me I've never used the microphone yet, and so I've broken the rules consistently, so I think now that we're near the end of the term, I can follow the rules. Welcome to the ONeill Institute. And today our session is on public health and chronic disease. It's a refreshing change since we spent a lot of our time on infectious diseases, global, national, and also a lot of our time on genetics and IP and things like that. But this is really the first session where we're talking about what is probably the most important public health issue facing the United States. Increasingly, there's an epidemiological transition, not just here, but across the world and in developing countries. The growing burden of chronic diseases is quite stark and will soon, according to the WHO, overtake infectious diseases internationally, including the world's poorest countries. And we have a remarkably robust and intellectual group of homegrown talent here today. And I'll just introduce them very briefly. Our first speaker will be Professor Greg Block, who he's professor of law here at the Law Center and adjunct professor at Johns Hopkins Bloomberg School of Public Health, a visiting fellow at Brookings Institution and at the Harvard Program on Ethics and Health. Greg is a national and international leading scholar in healthcare and public health. He's written including a very important with Professor Richard Epstein on the question of obesity, and one of the best articles I've seen on the subject in the Georgetown Law Journal. Professor Angela Campbell directs the First Amendment and Media Law Project, the Institute for Public Representation clinic here at Georgetown. She has been one, if not the persons in the United States looking at questions of the First Amendment, commercial speech, and advertising, particularly as children and the targeting of children, not only on television and other, particularly on the internet, which is becoming increasingly important. And then last but certainly not least, Dean Wendy Perdue. Dean Perdue, also a professor here at the Law Center. She served as law clerk for Anthony Kennedy and was an associate in Hogan and Hartson, leading scholar on civil procedure, but has recently played a very important role on questions of obesity, being one of the major scholars for the recent CDC initiative on obesity prevention, where she brings a great experience on the planning board at Montgomery County. So she thinks about land use, land planning, and public health and obesity. These are critical questions, and so we're going to be hearing about this question of diet and exercise from the perspective of ethics and law, the perspective of the First Amendment and advertising and information, and with respect to the environment in which we live. So it promises to be a very rich and important discussion, and I thank my colleagues for coming. So Greg, you're up first.
Thank you very much, Larry, for that very gracious introduction. I don't usually take cell phone calls while I'm on panels, but there's something that went awry with my daughter's pickup arrangement for school. So when I finish my remarks, I'm racing outside to make a call back and check into that. The affiliations are 2 years old, and I'm 2 years older, extra gray hair. But it's great to be here. And I want to begin by thanking Tim Westmoreland for which I'm going to open. And Tim is a national asset, not just an asset to Georgetown and to ONeill. For more than a generation after antibiotics became commonplace, the tiny brown bacterium known as the pneumococcus remained a pitiless reaper of the elderly. It suddenly showed up. It would suddenly show up in their lungs, and they reproduce at an astonishing rate, suffocating its victims within hours. And then in 1978, the Food and Drug Administration approved a vaccine, one that had the potential to save tens of thousands of older Americans every year by boosting their biological defenses against invading pneumococci. But the law prohibited Medicare from paying for it. The Medicare statute, which was modeled on private insurance, specifically excluded coverage for preventive care. Congress moved quickly to cover the vaccine and to empower Medicare to pay for other preventive services. It's unlikely, though, that such a law could pass today. That's because Congress today follows pay-as-you-go, or so-called PAYGO, budget rules, which keep bills from coming out of committee unless they're budget neutral over 10 years, or better yet, a net savings. And it turns out that letting pneumococci kill grandma would save money. And that leads to what I'm going to talk about today, which is the role of preventive care, preventive services in healthcare reform, which is something that's much at the forefront. Preventive services is much at the forefront. Talk about healthcare reform on both sides of the political aisle. This pneumococcal vaccine cost lots less than what Medicare would have had to pay to treat pneumococcal pneumonia and other illnesses that immunization would prevent. But the problem is that it lets grandma live longer. She busts the budget by going to the doctor later in life for pricey care that she wouldn't need if she were only dead. On the political stump, the standard story is that prevention saves healthcare dollars. And we heard the standard story in the campaign from both sides of the aisle. And the standard story is dead wrong. The pneumococcal vaccine's net cost for Medicare is more the rule than the exception. An analysis that appeared in the New England Journal of Medicine last February found that fewer than 20% of almost 280 preventive measures that were studied actually lower healthcare costs. The rest raise medical spending, and that's not even counting the effect that I was just referring to, the extra cost that patients occur down the line for illnesses they could have avoided if they had just died. So it's great news that political leaders are pushing prevention, but the PAYGO rules do promise a nasty awakening. Medicare's prescription drug donut hole is what's likely to happen when health reformers calls for prevention wend their way to the Congressional Budget Office for PAYGO scoring. Proponents of prescription explored the CBO several years ago to count savings from costly treatments that were made unnecessary by easier access to medication. But CBO refused, warning that, quote, to the extent that a drug benefit helps people live longer, they may consume more health care over their remaining lifetime than they would have without the benefit, unquote. And this was hardly an academic exercise, the drug benefits designers began with a premise that was dictated by politics, that the program could cost no more than $400 billion over 10 years. And by counting medical spending on survivors, people who live longer thanks to the benefit, the CBO forced the program's designers to enlarge the so-called donut hole, the gap in coverage that's meant to keep costs below $400 billion. In 2006, the standard benefit kicked in after a $250 deductible, then phased out entirely after seniors spent $500 more. They were then on their own for the next $3,000 before the benefit phased back in. And this design quirk invites people to start and then stop drugs that control cholesterol and blood pressure and other conditions that make catastrophic illness more likely. Our colleague Tim Westmoreland, who ran Medicaid during part of the Clinton period, warns that this is mere prologue. Pago, he wrote last year in a wonderful piece for the Georgetown Law Journal, portends disaster for health reform because it counts costs but ignores health benefits. Most preventive measures raise medical spending, but yet they're worth paying for. More than 80% of the 279 preventive steps studied in the New England Journal piece that I mentioned add to America's healthcare bill, but most of these deliver good value for the money, according to the most widely accepted way of attaching a dollar value to a year of life saved. This method, which is based on studies of the costs that consumers and workers incur to avoid deadly risk, prices life at about $5 to $10 million a year. And the health economist David Cutler has roughly translated these figures into a cutoff value of $100,000 per life year saved. And of the preventive measures that raise medical spending, of the preventive measures in the study I mentioned that raise medical spending, more than 3/4 buy longer life for less than $100,000 a year. So they save money. We ought to pay. But PAYGO won't let public subsidies cover them unless Congress cuts other programs or raises taxes to offset the cost. And Tim calls this immoral since it disregards the value of lives made longer by judicious investment in people's health. Tim, who is the leading scholar of congressional budgeting and its legal convolutions, calls provocatively for another kind of PAYGO, a prohibition on consideration of any bill that shortens lives or harms health, absent offsetting health benefits. The current PAYGO scheme, he says, mandates, quote, euthanasia by budget, even when the spending is stymies would buy life years on the cheap. And it enables legislators to cloak cruel choices, therefore in the garb of fiscal responsibility. This, I think, is a bit of an overreach. PAYGO lets Congress pass pricing programs so long as it raises taxes or cuts spending elsewhere. And it thereby highlights our hard choices, and it challenges advocates of new spending to make the case for its comparative value. So it's not fair to say that PAYGO disregards benefits, forces new programs of proponents to promote them. And the real problem, I submit, for advocates of prevention and for proponents of coverage expansion more generally is that the necessary trade-offs are politically toxic. Phalanxes of stakeholders guard current healthcare spending. And in the best of times, tax hikes are a career-risking proposition for Pauls, and we're not in the best of times. So subsidies for preventive care are a difficult sell, especially since its benefits accrue down the line, while spending cuts and tax hikes hurt now. The same basic problem besides preventive care. In the private, not only do consumers disregard or discount its long-term benefits, employers who pay for most private coverage don't come close to fully capturing its economic return. Job turnover, accelerated by global market pressures, means that the productivity gains from illnesses avoided accrue to future business rivals. And the same is the case for medical cost savings that ensue from preventive measures. So employers lack the incentives to pay for the full business value of prevention, let alone its less tangible health benefits. And the calculus that marks down the value of prevention is similar for health plans. They fashion benefit packages to fit employers' recruitment and retention strategies, and they take account of patients' frequent movement among insurers This movement strongly discourages investment in prevention, since it keeps plans from fully capturing even near-term cost savings. What can be done about this mismeasure of prevention in both the public and private sectors? Nothing, unless prevention's advocates can get Americans to pay attention. Wonkish arguments won't do. What's needed is the alchemy of admired leadership, something we're about to have. Real alliances. Think what a year from now, starring Obama, McCain, the governor, and maybe even throw in some sexiness. Well, invite Angelina Jolie to the gala that reliably seizes Americans' attention. But getting the wonkish part right is also key to make sure that people's attention isn't just a passing thing. There's an urgent need for a large-scale effort to measure the impact of preventive measures on the length and quality of people's lives. And there's an urgent need to make the case popularly as the measurements come in. Proponents of prevention ought to take a cue from conservatives who have long demanded cost-benefit analysis of regs that burden business. Many progressives eschew cost-benefit analysis because it puts a dollar value on life, but surely the lives saved here are better priced than ignored. Cutler's $100,000 a year appraisal for a life year saved, is a reasonable starting point for efforts to convey the value proposition of prevention. Some say we ought to discount the value of life years spent in pain or made less meaningful by disability, but doing so would run contrary to ideals of equal treatment that are deeply embedded in our culture and law. This would also be a source of bitter conflict, even though there's a case for doing so. So let's avoid the conflict and stick to this formula. Getting to yes on how to count health benefits would empower public officials to push back against the read-my-lips resistance to new revenues. And it would arm advocates of prevention to challenge spending programs that owe their survival to interest group power, not health benefit. And pay-as-you-go budgeting doesn't have to lead to euthanasia by budget, so long as the proponents of high-value programs make their case. But does this mean that reformers can achieve a wholesale shift in spending priorities from pricey rescue-oriented care to maximization of health through preventative measures? I think that's hardly the case. Not only are lots of rescue-oriented treatments high value and worth encouraging. Think about surgery that excises an early breast tumor or the stent that opens a clogged coronary artery. Rescue, even at great cost, is one of medicine's core purposes. In the film Saving Private Ryan, the larger ends of war dissolve as a platoon takes senseless risks to help to find the lost soldier. Senseless, that is, if one disregards the combat deaths of his three brothers just days earlier. That this family catastrophe is special enough to provoke General George Marshall to order his commanders to find Ryan and to, quote, get him the hell out of there, is the film's central trope, and the basis for its celebration of Americans' commitment to its citizens as separate ends. Men die as the quest unfolds, and their sacrifice is ennobled by mutual devotion. What goes on in critical care units during the last month of life, our extraordinary savings in pursuit of slim chances, may not match the heroism of battle, but it reflects our reluctance to abandon each other in dire circumstances. And medicine celebrates this refusal to abandon. This refusal animates the Hippocratic promise of loyalty to patients as individuals. Americans expect this loyalty and the rescue-oriented care that it inspires. So quite apart from interest group power, the ethic of rescue pushes medical spending priorities away from maximization of health toward special regard for people in desperate straits. We wouldn't want to live in a society that treated lifespans as abstractions to be maximized without regard for loyalty or love or fellow feeling. But we have come too far on the rescue front. It's often noted that more than a quarter of all Medicare spending occurs in the last year of life, which is a self-evident measure of a rescue effort unfulfilled. What Lewis Thomas termed halfway technologies, sophisticated in engineering terms, but based on crude understandings of human physiology, run up the bill while delivering dubious value. So we need to become more reluctant to pay for rescue technologies without proof that they work. We can and should do so without stifling hope. Cutting off access to widely used treatments, methods that people believe in, even if the clinical evidence is questionable, is sure to arouse ire. But we can set the bar high for new treatments, new high-cost treatments, the evidence bar high, and therefore channel more money into prevention. There are, though, some limits to this economic logic. Imagine an effective preventive measure, say an engineered strip of DNA that enables our immune systems to detect and destroy cancer cells. Assume that that insertion of this DNA strip into our genomes would add of life, on average, to every American at a cost of $50,000 per life year gain. That's a bargain if you think about Cutler's $100,000 value for a life year. But to provide this cost of prevention to everyone, to all 300 million of us, would cost $75 billion. Life year times 5 life years times 300 million Americans. And that's almost 6 times our GDP, basically an implausible expenditure. And there's room here to quibble about these numbers. Mass use of the technology would probably lower its price. And after one-time only treatment for all, we'd only need to incur a fraction of this cost every year, maybe about 1.2 pace with births and $1.2 trillion is more than half of what we spend per year now on medical care. Provision of this treatment to everyone is unimaginable, even though it buys life years at a bargain price. So the larger point or paradox here is that we can't afford the full range of preventive measures that save life years at prices worth paying. Medicine's capabilities are too vast. The clinical possibilities on the horizon are more than enough to swallow up most of our national wealth, and this expands to prevention as well. And because we're motivated by needs and pleasures other than maximization of life years, there's limits on our willingness to grow clinical spending, even when it extends. In the language of economics, medical care has opportunity costs in the form of other benefits foregone. These opportunity costs soar as rising health spending crowds out the pursuit of other goals. So Cutler's $100,000 value for a life year can't and won't be for prevention. We'll in general spend lots less on clinical measures that delay the onset of disease. But there's another paradox here. The non-medical pursuits that limit our willingness to spend on preventive care probably make us healthier. And this leads into what Wendy has to say about the built environment, which is probably a more important health policy than much that we do with medical care. There's overwhelming evidence to support the conclusion that social and economic factors have a larger influence on our health than does medical care. Income, educational achievement, and other factors correlate much more closely with health status globally as well as within this country than does medical spending. The causal mechanisms aren't well understood, but it's thought that wealth and education shield us from life's stresses and risks and feed our self-confidence and encourage us to take the long view on lifestyle matters. So resources committed to better housing and schools and healthier eating and recreation and social networking clinical pursuits contribute to our health. And restraints on medical spending, including preventive care, free up money for such pursuits. The Democratic presidential primary kerfuffle over requiring people to buy health insurance brought this trade-off to the forefront. And having been a bit involved in that kerfuffle, I think it was mostly a source of brain damage for all of us in the midst. But I think there was one useful lesson that came out of it. Senator Clinton argued quite plausibly that such a mandate, if adhered to, would reduce the numbers of the uninsured. But as two of her advisors, Jeannie Lambrou and John Gruber, observed in an article, forcing people to buy coverage, quote, could impose a large tax on individuals with modest incomes, providing them access to health care, but diminishing their ability to pay for food, shelter, education, and other basic necessities that contribute to health and well-being. Consider, for example, a family of 4 that earns $65,000 a year. That's about 3 times the poverty line, but lacks employment-based coverage. What health effects ensue from forcing that family to divert $12,000 per year, the cost of comprehensive coverage for preventive and rescue-oriented services, from rent, food, and child care to insurance premiums? No one knows. We don't have this data. But even if a federal subsidy, say a refundable tax credit, took care of half the cost, the financial hit and the impact on the family standard of living would be enormous. The specter that haunts calls for preventive care today is that the life years lost by lowering living standards to pay for it could exceed the gains from its clinical efficacy. Prevention in some is being both oversold and undervalued in our squabbles over healthcare reform. If President Obama pitches preventive care as a cost saver, the CBO is going to shoot this claim down. From the government's perspective, dying is cheaper. Providing subsidies to help people pay for prevention will add to health reform's price tag, requiring higher taxes or cuts. Prevention's advocates shouldn't blame budget rules for forcing these trade-offs. They should make the case for its value, formulating frameworks for comparing its benefits and costs, pointing to examples of life years gained at low cost, and building our national capacity for research into its effectiveness. It's implausible, though, for the reasons that I've talked about, to expect that prevention is going to get with rescue-oriented care. Some of us are going to die sooner because of the money we spend on rescue-oriented care, since that money is channeled away from support for aspects of our lives that improve our health in non-clinical ways. But that rescue is part of who we are. Measuring the efficacy of pricing treatments is a matter of life and death. Saying no to new technologies that don't perform is also a potent tool of health promotion. To the extent that we keep a cap on what we spend in the healthcare system, we can make money available for other kinds of social and economic programs that improve health in a more cost-effective fashion. So let's make the case for preventive care, but let's do so with a sense of realism about its costs, about political resistance and market failure, and about medicine's competing purposes. Thank you very much. Does the format want Q&A discussion at the end, or
I think we'll do it at the end, yeah.
Okay.
What we'll do is we'll have 3 discussants, then we'll take a quick break, and then we'll have questions, and then reception.
Okay, well, you can get the computer set up. I'm going to be talking about prevention, but in a different way. I'm going to talk about recent efforts to prevent childhood obesity and all of the different health problems that are associated with obesity by reducing the marketing of unhealthy foods to children and adolescents. Thank you. And I'm going to try to, I've got some slides here. I want to quickly go through to give you the background and then hopefully leave enough time to focus on some of the more recent developments. In 2004, the Institute of Medicine established a committee made up of people from diverse professional backgrounds to explore what was known about current food and beverage marketing and how this marketing influenced diet and health of children and youth. They conducted a very extensive literature search, and they published their findings actually in a book that was released in December 2005. And it's just full of information. One chapter is devoted to marketing in particular, and some of the findings. I'll just start with some of the findings. That the amount of money spent for marketing all food products in 2004 was approximately $264 billion. Of that, about $10 billion, they estimated, was spent on marketing food to children and youth. The most prevalent way of marketing these food products to children was on television. Yes. And most of the ads on television on children's programs were for foods that they dubbed high caloric, low nutrient. So they made a number of recommendations. Most importantly, that because there was such imbalance in the types of food products that were being advertised, they wanted food companies to shift their advertising to products that were healthier, that were lower in calories and added sugar, higher in nutritional content. And they specifically urged the food companies to work with an organization called the Children's Advertising Review Unit. And what this is, it's a self-regulatory organization that's part of the Council of Better Business Bureaus. And it was originally started back in 1970s when, at that time, there was also a lot of concern about advertising to children, particularly products. And this organization was basically set up to stop the government from regulating because they would self-regulate. And over the years, when there's been a new crisis, they, occasionally will update their regulations to deal with that. And they had some other recommendations as well. And most importantly, they thought that, they really thought that the industry should step up to the plate, that they really had a lot to bring to this. But if the voluntary efforts didn't fail, or didn't succeed, that then Congress should step in. And they suggested that in 2 years would be an appropriate time for the government to report to Congress on progress. Now, so what has happened? In April 2006, the Federal Trade Commission came out with its own recommendations that grew out of a workshop they held with industry and advocates. And they thought they had some very specific recommendations. And even though they recognized that the advocates thought that the industry wasn't doing enough and that they had concerns about self-regulation, they thought that KRU should be given a chance to really review its process and see what he'd come up with. It also had recommendations for the media companies who are not part of the Children's Advertising Review Unit, that they should limit the character licensing to nutritious products. So the Council of Better Business Bureau, in fact, hired the former FTC head of the Consumer Protection Bureau and to do a review. And instead of expanding the Children's Advertising Review Unit, what they decided to do was to establish something that they called the and this was announced in November 2006. But the details of the program were not announced until the FTC's workshop in the summer of 2007. Now, the way this initiative works, it's completely voluntary. Companies can choose to join the initiative if they want to or not to. If they do join, however, they do have to adhere to certain core principles. And at least half of their advertising to children on the traditional media of television, radio, and print, and the internet either have to be for products that are better for you or having some encourages good nutrition or healthy lifestyles. They have to reduce their use of licensed character marketing and limit it to, or at least most of it should be for meet the criteria that are better for you. Same thing with product placements. Down to there's some other things like advertising in schools that it's not really the focus of my talk, but you can see some of the principles here. Now, initially, 11 companies joined the initiative. Since then, there's been 2 more. These are all the participants, and these companies account for approximately 2/3 of all the food and beverage advertising to children. Now, even though each company gets to design their own pledge to kind of meet their own needs, their own products, and their own ways of operating, and so they're all very different. And just to give you an example, Kraft agreed that they would have no advertising to children under age 6, that all of their television advertising would be limited to what products in their line, what they call sensible solutions, and they would become effective immediately, whereas McDonald's, it only agreed for their national advertising, and so that's another thing about how they define that. They would only advertise meals that meet certain nutritional criteria of a maximum of 600 calories, no more than 35%. It could be from fat. And these would not take effect until January 1, 2008.
Now, I know you can't read this. I don't expect you to read it. This just shows, this is from a report that the initiative did, all the different definitions that they use for how they decide whether media is child-directed, because these restrictions only apply to child-directed media. So some of them use numbers. So, for example, Mars says any program that has more than 25% of the audience is under 12 would be considered children's media. But Coca-Cola defines it as only audiences where of the audience is under 12. So there's a really big difference in the way they define. And another company, for example, Pepsi, they have a whole bunch of different factors they look at, and none of them are controlling. So they look at who the content was designed for, who the product was intended for, where the media is and is promoted, the time of day that it's aired, and so on. Now, in addition, every company has their own nutritional guidelines, their own criteria for determining whether their food falls into the so-called better for you category. And even just like among the fast food restaurants, they're different. Burger King can only advertise kids' meals that have a maximum of 560 calories, of which 30% are from fat, and McDonald's is higher at 600 calories, 35% fat. Here's Kraft's criteria for their Sensible Solutions product line in cereals. They have different criteria for different products. And on the other side of the screen is the nutrition panel from Honeycomb cereal. And it meets their criteria for Sensible Solutions or better for you foods. And so they can advertise this to children without any restriction. ONeill has just somewhat different criteria, and some of the products that they make that fit their standards include Cocoa Puffs, Cookie Crisps, and Chocolate Lucky Charms. Now, the Food and Beverage Initiative released a report in July. Of six of the companies whose pledges were actually in effect during the latter half of 2007, and it found that all of those companies were in substantial compliance. There were a few problems, but they were relatively minor and they had been resolved. The same date, the Federal Trade Commission released a report to Congress on marketing to children, and this report grew out of a request by Congress that they collect information from companies using their to answer a number of questions, and they use their compulsory authority to compel companies to provide information, proprietary information. And so the information, while it's useful, is not. It's all in the aggregate. You don't know who provided it, or so. Their report, again, it's quite long, makes a lot of different findings. The most important things I think that it does is that it catalogs the different techniques that are used in marketing food to children. And this chart, which actually doesn't come from the report but someplace else, it defines some of the techniques that are being used, and the report found the same thing. So I want to just, if you don't have small children, then you probably are not aware of a lot of this stuff. So I wanted to just give you some examples of what we're talking about here. Okay, let's see. But one thing before I do, one point that the Federal Trade Commission made was that virtually all products except for fruit and vegetables used the entire spectrum of these techniques, and that ad campaigns themselves were integrated and all pervasive. All right, so product placements. Sometimes that's also called embedded advertising or product integration, and those have grown tremendously, really all across the board in recent years. I'm going to show you this a clip that was put together by the Writers Guild of scenes from a show called Seventh Heaven, which I don't know the show, but I understand it was for many years. Give me a second to make sure I can do this. Oh, doesn't make any sense without sound. Here.
You can feel it.
The point comes across pretty clearly.
So the stories are woven into the storyline. My favorite scene is, no, it's still actually coming up. All right. Well, I think you got the point there, so let's stop that. But I still need the sound from my parent.
It was on mute, so it did show mute initially.
Yeah, but then I turned it off. I think that's going to do it. Can you hear?
Yeah.
Cookies and milk.
Except for this one.
Cookies and milk.
Nah, I like the cookies separate from the milk. I'm a purist.
You know, I used to be a twisting leg. Now I'm a dunker. My whole family are dunkers. Except for Sam and David. I guess I'll grow into it.
Lucy dunks in front of the family. When she's with me, she twists and scrapes the filling off the outside.
No kidding.
No kidding. I think it's time for me to go home. We should be having cookies with our brides.
I love it.
Let's see. You're a twist and dunk, right?
Yeah. I know your family are dunkers, but the only thing my parents ever agreed on was this.
Now, here, I want to show you some other examples. So the first thing I'm going to show you is a television ad for Honeycomb cereal that was aired on the Cartoon Network. All right, mouse, there we go. I don't mean to pick on Kraft. It's just when I on Friday I just started watching TV, and one of the first cereal ads I saw was for Honeycomb, so I decided that would be the one I would show you.
And let your mouth decide for itself. Then, use the code inside specially marked boxes of Honeycomb cereal to access the Taste and Tell poll at Postopia.com. Cast your vote and get 10 Post tokens. No. Seriously, guys, let it go.
Okay, so one thing that demonstrates is what we call spokes character marketing. And here they've very cleverly actually taken the product itself and made it into a character that dances and sings and gets the children's attention. Another thing that this one does is that it demonstrates the use of premiums. You have to buy the cereal to get the postcode. And then you have to go to the website to use the code to get your prize. Now, what happens when you go to the Postopia website? So look at that next. Now, these websites, I'm not really picking on those because all of the companies have them, and they're very cleverly designed to really keep children's attention and have them spend a lot of time on the project, on the websites. And this one you can become a member. I'm already logged in, and let's say I want to play a game. Okay, so. I mean, there's just many things to explore on here. We don't have time to do them all. So I'll go to games, and I pick this first game, the Bedrock Dance game, Bedrock Dance Academy, and it's going to take a second to load. Let's see. So what you first have to do, if you want to play this game, is you have to create a character.
So this game is one of the few that I actually was able to play. Right at the right time. How do I pause it? I know.
You have to win or else it doesn't go up.
Pause. Go back to the menu. But you saw the background there, right? The Cocoa Pebbles in the background? Okay. Now, another thing that you can do here is you can do what are called e-cards. And here you put in your friend's email address, and you can send them the character that you created, and then they can play the game too. So this is an example of what we call viral marketing, because kids are becoming the marketers. They think it's fun to do these things, and they send them off to their friends, and that promotes the product. Okay, now not only do they have this Postopia website, which I think has games for all of their products, but Kraft has developed websites that are specific to their specific particular products. So for the honeycomb cereal, they have something called bboy.org. And I knew about this because I saw the TV ad, and they had the website address in the ad. So again, but this is also an example of character marketing. The B-boy is a boy who he's a fictional character, but he has this whole story built up around him. He was supposedly raised by bees, and this sort of anthropologist-type person finds him and is trying to, civilize him, and the only thing he wants to eat are honeycomb. You have this bee cursor, and you move through the site, and it's very clever. Well, here's a game you can play. I'm not going to play it, but you have to. You really don't want to play it. Get the honeycombs, as many honeycombs as you can before you go into the hive. You can look at pictures. They have videos. They have other things you hear. This is one that you can ask questions, and if you want to know what are the B-Boy's 3 favorite foods, they're honey, and honeycomb cereal. And you can send in a question, and you have to give your email, so then now they have a way to contact you. And then there's also links, so you can go from here back to the Postopia site, and so on and so forth. Okay. Now, this pie chart is from the Federal Trade Commission report, and what it's showing is how the expenditures are allocated among the different types of marketing. And you can see that the traditional measured media is the largest category at 53%. That's television, which is a predominant category, radio, and print. The second largest category is something called other traditional promotions, and that includes the product placements, movie theater, video game ads, character or process promotion license fees, celebrity endorsements, and a few other things. And
it said that one of the most consistent themes in advertisements directed to children and adolescents appearing in nearly all promotional formats and for nearly all product categories was the use of cross-promotions and third-party licensed characters to promote food, beverages, and restaurants. The company spent almost $240 million, or 13%, on marketing campaigns involving cross-promotions. But this figure does not include another $360 million that was spent for the toys that are used as promotions in kids' meals at fast food restaurants. The report also identified 80 different movies, TV shows, and characters that were used often to promote multiple products in cross-promotions in 2000 alone. And so these would be things like the Batman movie, which was used for canned pastas, soups, and fruit snacks. Or Curious George. Curious George is sometimes cited as a good product marketing because it featured Dole bananas. So bananas are good for you, but it also was used by fast food restaurants and to market snack cakes. So I think there are some mixed messages that are being sent to children. The smallest amount of expenditures is in this category called new media, which is only 5%, and this includes things like the media company-sponsored websites, internet, digital, word of mouth, and viral marketing. But the FTC cautions that the focus on expenditures in this category may underestimate the degree to which marketers have used the internet to reach youth, because many promotional activities, such as the viral marketing, require little or no financial investment. But I actually think there's a more fundamental reason that they did identify, and that is that it's really much more economically efficient for marketers to reach children in this way than the traditional ways. And I'll give you an example. Let's say that the product that you're trying to sell is oriented for children. Let's say it's something like SpongeBob waffles. So you could buy time on Fox's American Idol. That show reaches 300. There is such a product. Reaches 3 million children. But those 3 million children are only about 20% of the total audience. And you, as an advertiser, have to pay to reach the entire audience, even though you're only interested in reaching that 20%. So instead, you can buy a banner ad on Nick.com, the Nickelodeon website, and have it click through to your own website or your own ads or whatever you want it to go to. And this is going to cost way, way less than network television. And you're going to reach almost exclusively your desired demographic, children who like the Nick characters. So going back to the report, they also calculated the total amount of expenditures, and broke that down by age group. And this report came out in July. I don't think it got much public attention at all, unfortunately. To the extent it was covered by the mainstream press, the headline was $1.6 billion was less than prior estimates, and that this really wasn't a lot of money. And now even the FTC recognized, though, that this was not the total figure, because their information request was only from 44 companies, not all of whom were even food marketers. So it was not by any means a comprehensive study of all companies that advertise foods to children, nor did it include information about all products. For example, they didn't ask about gum. It didn't include all the costs, as I mentioned. They didn't include the fast food toys. And they were very careful to limit their questions to media that was directed at youth. So American Idol, because it would not be counted, or The Simpsons, or Family Guy, or other shows that are very, very popular with children and teens, but because they're also watched by adults, they don't meet the criteria to be considered directed at children. I also think that in any event, $1.6 billion is a lot of money. It's almost 4 times as much as the money the federal government has allocated to NIH for obesity research in 2005. Another thing that the Federal Trade looked at was the types of products that were marketed to children, and you can see that the largest category is carbonated beverages. That amounted to about $20 per American teen. 2006 was spent to market to them carbonated beverages. The next largest category is restaurant foods, and these are mostly what they call quick-serve food restaurants. The smallest, of course, is fruits and vegetables. So I think this report poses a number of questions for the future. One is like, how do we monitor whether the companies are complying with their pledges? And who should be doing this monitoring? We know that the Better Business Bureau is doing some monitoring, and they say they will continue to do that, but do we really trust them to do a good job? The Center for Science and the Public Interest is planning to do a food marketing report card in the future. But I don't know who else is really doing this, and I think we probably need multiple organizations really looking at this to get the complete picture. And there's a number of problems. Is not aware of these efforts, I think, by and large, so they're not bringing them to anyone's attention if there are violations, if they even notice them. And then the other problems with monitoring are the lack of uniform standards, problems, these things like the impact of viral marketing and social networking. A lot of the information that is needed to do the such as the audience composition of particular shows is not publicly available. And moreover, the ad campaigns themselves and the product formulations are changing all of the time. And this is just showing a little sort of quick and dirty study that Center for Science and the Public Interest did. They had analyzed NIC's marketing back in 2005, and they did it again in 2008, and they found that there was range. In 2005, they found that 79% of the foods marketed to children, this is on print, television, and the licensed characters, were for foods that were too high in fat, salt, or sugar. And it was 88% in 2005, went down to 79% in 2008. But actually, one category, the licensed characters, actually increased. But how do you evaluate that, even if you have the information? So the obvious first question, are they meeting their pledges? But another question is, are the pledges themselves adequate? And I think one of the main issues here is whether the better-for-you products really are products that are good for you, and whether those are if kids are going to switch and use those products, whether it's going to actually have any impact on their health and weight. So how are these changes in marketing related? Are they actually having the intended effect of reducing childhood obesity? And I think some other problems are the lack of funding and lack of basic research in this area. There is a lot of research, but it is done by industry and it is proprietary. But the ultimate question, I think, then becomes, well, how adequate is self-regulation going to be? I think, we have seen a lot of efforts made. I mean, it really is pretty... in the way policy works, I think a lot has been done in the past several years. But I also think there's many ways that it could be improved. It needs to be expanded, for example, to packaging, which isn't covered right now, and some other types of marketing. It needs to be all companies. They need uniform standards. I think teens should be included. And so we'll have to wait and see, but the other problem is, of course, that there are sort of inherent limitations with self-regulation because companies' interest is to make money, and they're only going to do it to the extent that there isn't too much conflict with their goals, and to the extent that they think that they're going to prevent government regulation, and that raises a whole other set of questions about how much the government can do and what are the limitations imposed by the First Amendment. But those are really questions for another day, because I think I've probably used up more than my time. Thank you.
There we go. Okay. So as Larry indicated at the beginning, chronic disease is becoming a growing issue in the U.S. and increasingly around the world. And one of the conditions that is most closely associated with a whole host of chronic disease is obesity. In the United States, obesity is growing. There we go. Obesity is growing. Okay, so there's 1994. You see, in 1994, everywhere in the United States, we're seeing obesity rates of under 20%, and in the West, under 15%. That's 1994. This is 2007. By 2007, we've got everybody but Colorado over 20%. Colorado actually has a culture of physical activity that may have something to do with its trends. So, and then you see places, you see a couple of states with obesity rates over 30%. This is very bad from a health point of view. So here is just a list of some of the conditions associated with obesity. Coronary heart disease, diabetes, cancers, hypertension, stroke, lots of troubling conditions. Okay, so what obesity? Basically, the simple story is it's a energy imbalance. More in than goes out. Taking in more calories than are used up. Now, that said, it's also worth noting that actually quite small changes can make a very large difference. So a net reduction in calories of about 100 a day over the course of a year would result in about a 10-pound reduction. This is the average adult. What's 100? It's walking a mile. It's half a serving of McDonald's French fries, or it's a Coke. So some combination of that, that's a 10 pounds, and some experts have suggested that that small change would have a very, very dramatic effect on health. Okay, but since obesity is at some level about individual behavior, what is the person eating and what are they doing in the way of exercise, some have argued that the solutions likewise should be individual. Richard Epstein, in the exchange that Larry mentioned, exchange with, argues, and I quote, "Better a bit of self-control than a ton of state initiatives." So just have people behave better, and the problem goes away. But this ignores the reality that the context in which individual choices are made has a profound effect. And government has made a whole host of decisions that quite literally have changed the landscape. So, just walk more. Why don't the people in this neighborhood walk more? Somebody decided to put telephone poles in the middle of the sidewalks. That's a policy choice that got made. Well, walk to the bus more. You'll only have to cross 6 lanes of traffic. The closest intersection in either direction is half a mile, and then you will stand on a hillside to wait for the bus. If people would just behave differently, the problem would go away. But we've made a set of policy choices that have obviously dramatically altered the environment in which, or shaped the environment in which people are making those decisions. Access to healthy food is a critical factor in obesity. But the number of grocery stores in the United States has actually declined over the last 40 years, and particularly in poor communities where the data suggests there are dramatically fewer full-service grocery stores. And so if your local grocery store, the 7-Eleven, with a wide array of choices ranging from Spam to SpaghettiOs, the choices, the so-called choices that people make, are going to be different. Likewise, there's empirical data linking obesity rates and proximity to fast food restaurants. And there is also pretty strong data suggesting higher concentration of fast food restaurants in poor neighborhoods, which have higher obesity rates. Finally, access to recreation is an level of physical activities, and we see significant in terms of access to these kinds of facilities. Okay. Now, another critical point to understand is the government's role in shaping what the environment looks like. A community that looks like that isn't simply what the free market chose to build. There are a whole range of regulations which have affected that environment. Setback requirements, density requirements, a variety of land use regulations that result in an environment that way. And indeed, the rules may be such that this community, it can't be built in many places. The slide I showed you before may be what the zoning fundamentally requires. It may not permit this, given the array of the interplay of a variety of land use laws. Why are there so few supermarkets in some areas? The answer to that is quite complicated. Depends on lots and lots of factors. But among the explanations are things such as a standard zoning requirement, which is 5 parking spaces per 1,000 square feet of gross leasable space. That's a pretty standard requirement. And that means the standard grocery store needs 175 parking places. That means you need a really big piece of land, and it needs to be laid out in a way that lends itself to that. Even if you have a story that says, but my customers aren't going to drive, you're going to have to change the zoning laws in order for that store to get built. Aside from the, just we have a place for it to significantly increase costs and alters the economic feasibility calculation, which in some communities may make the difference. Grocery stores are pretty low profit margin operations. Finally, government is investing in our physical infrastructure all the time and choosing what to build and where to build it. These are both high schools. I wonder why these kids don't walk to school. These are on sites that are probably between 25 and 50 acres in size. They've been located in places and set up in a way that makes it inconceivable that kids are walking in. That's the government has chosen to build this facility this way, and it has implications. So we've structured a physical environment in a way that reduces the likelihood that children and others will be physically active. That's the physical environment. There are many other elements in the environment that are affecting people's choices. You heard from Angela talking about the advertising. We have food and nutrition policy. We heavily subsidize certain kinds of food products, particularly corn products that result in, that make high-density food relatively inexpensive compared to other foods. We have an information environment, including advertising and labeling. We have a host of school policies and other kinds of policies that affect the environment in which choices are made. New York City and California have recently adopted menu labeling requirements, which would be interesting. Here's a menu that would comply. The Big Bacon Omelet will set you back only 1,430 calories. That's get your breakfast off to I think it's listed as a hearty breakfast. That seems like a fair characterization. And there is some data suggesting that menu labeling, point of sale menu labeling, has an impact. Not a huge impact, not thousands of calorie impact. One study I saw was 50 calories. Okay, but you saw the 50 calories, that's halfway to your 100 calories a day difference. So maybe you don't order the extra large fries. Okay, so the changes may be small. New York has also added, along with the menu labeling, they're now doing Subway ads. 1,000 calories a day is all most adults should eat. It'll be interesting to see whether that kind of information changes the choices that people are making. So, obesity is a consequence of individual choices that people make. But the choices are made in a physical and social environmental context. And that context is the result of a very complex government policies that has created the environment that we've got. Earlier era, the major public health crisis was infectious disease. And that problem was seriously exacerbated by a combination of government policies, both action and inaction. Today, chronic diseases have become the major health issue. And as with infectious disease, we can choose to create conditions that are conducive to health, or we can turn our backs and ignore the impact that our collective and governmental actions have on collective health. So that's it.
Thank you to our very rich and interesting three panelists. Why don't we take a quick break? We'll come back for questions and answers.
Some of them are my pictures.
Set up that. The answer was good as well. A lot of people
Did you send them all?
Meanwhile, I was coming to class every day like this, expecting to know.